Welcome. My name is Dale Ensign. I'm a regional training consultant with the SHEBA program, and today we're going to review the National Training Program, Module number 11, Medicare Advantage and Other Medicare Health Plans. The lessons in this module, Medicare Advantage and Other Medicare Health Plans, explain Medicare health plan options other than original Medicare. The materials are designed for information givers, trainers that are familiar with the Medicare program and would like to have prepared information for their presentations. This module is designed for presentation to trainers and other information givers. It can be easily adapted for presentation to people with Medicare. The module consists of 64 PowerPoint slides with corresponding speaker's notes and check your knowledge questions. It can be presented in about 45 minutes. Allow approximately 15 more minutes for discussion, questions, and answers. Additional time may be needed for add-on activities. One thing I'd like to note at this point before we get too much further into the presentation, this is a national level view of Advantage plans. The state of Washington does not have all the plans that are discussed here in this presentation, and there are some other differences as well. If you have questions, you should consult your volunteer coordinator or your regional training consultant. This session should help you define Medicare Advantage plans, describe how Medicare Advantage plans work, explain eligibility requirements and enrollment, recognize types of MA plans, identify other Medicare health plans, explain rights, protections, and appeals, and summarize the Medicare marketing guidelines. Know the rules for gifts, rewards and incentives, educational and promotional activities, and agents and brokers. Lesson 1, Medicare Advantage Plans Overview, will provide you the following information. What is an MA plan? How do MA plans work? When you can join a plan or switch plans? And what are the types of MA plans? Medicare Advantage plans are health plan options approved by Medicare and run by Medicare-approved private companies. In MA plans, you get all the Medicare-covered Part A and Part B services through the plan. Many MA plans also include Medicare prescription drug coverage. This is called Medicare Part D coverage. MA plans provide Medicare-covered benefits to members through the plan and may offer extra benefits that original Medicare doesn't cover, like vision or dental services. The plan may have special rules that its members need to follow. MA plans are part of the Medicare program and are also sometimes called Part C. MA plans are offered in many areas of the country by Medicare-approved private companies that sign a contract with Medicare. Medicare pays these private plans for their members' expected health care. It's important to note that when you join a Medicare Advantage plan or other Medicare health plan, you're still in the Medicare program. Medicare pays these private health plans for your care every month, whether you use the services or not. You still have Medicare rights and protections. In some plans, like Medicare Health Maintenance Organizations, you may only be able to see certain doctors or go to certain hospitals. You save the most money out of pocket when you get services through the plan's network. Cost sharing in MA plan does differ from original Medicare. If the plan decides to stop participating in Medicare, you will have the opportunity to join another MA plan or return to original Medicare. If you join a Medicare Advantage plan, you must continue to pay the monthly Medicare Part B premium. For most people, the monthly Part B premium in 2017 is $109. For 2018, it's $134. A few plans may pay all or part of the Part B premium for you. Some people may be eligible for state assistance, programs for people with Medicare who have limited income and resources. When you join an MA plan, there are other costs you may have to pay, like an additional monthly premium to the plan, deductibles, coinsurance, and copayments. These costs may be different from original Medicare, vary from plan to plan, and be higher if you go out of the plan's network. Medicare Advantage plans are available to most people with Medicare. To be eligible to join a Medicare Advantage plan, you must be enrolled in Medicare Part A and Medicare Part B. You must also live in the plan's geographic service area, and you must be a U.S. citizen or lawfully present in the U.S., and you can't be incarcerated. To join an MA plan, you must also agree to provide the necessary information to the plan, like your Medicare number, address, date of birth, and other important information, follow the plan's rules, belong to one MA plan at a time. To find out which Medicare plans are best for you in your area, you may go to medicare.gov, find a plan questions home.aspx, or call 1-800-MEDICARE. Also, of course, you can contact SHIBA. If you want to speak with a local SHIBA volunteer, you can call 1-800-562-6900. People with end-stage renal disease usually can't join a Medicare Advantage plan or other Medicare health plan. However, there are some exceptions. An individual with ESRD enrolled in employer-sponsored coverage, whether MA or commercial, i.e. non-Medicare, can enroll in another plan if the plan is part of the same parent organization and meets the criteria for doing so. For example, an individual who develops ESRD while enrolled in an employer group health plan may be allowed to enroll in an MA plan offered by the same plan parent organization, provided there's no break between coverage. People with Medicare with ESRD who are already enrolled in an MA plan may also enroll in another MA plan within the same parent organization, as long as the new MA plan operates in the same state, the person with Medicare meets all other requirements for enrollment in that MA plan as in the previous MA plan. CMS will permit a change from a health maintenance organization to a preferred provider organization or a private fee-for-service plan within the same parent organization, as long as the change meets all of the criteria. The term parent organization is defined as an entity that owns one or more contracts with CMS to provide MA plans. A person who's had a successful kidney transplant or no longer requires a regular course of dialysis treatment isn't considered to have end-stage renal disease for the purposes of Medicare Advantage eligibility. When can you enjoy Medicare Advantage plans? You can join Medicare Advantage plan during your initial enrollment period, which is a 7-month period that begins 3 months immediately before your 65th birthday, includes the month you turn 65, and ends 3 months after the month you turn 65. If you delay Medicare Part B enrollment, your time to enroll in an MA plan may be more restricted. Your chance to join lasts for 2 full months after the month your employer group coverage ends. For more information, see the Medicare Managed Care Manual, Chapter 2. If you get Medicare due to disability, you can join during the 7-month period that begins 3 months before your 25th month of getting Social Security or railroad retirement disability benefits, and ends 3 months after your 25th month of disability benefits. When can you join or switch Medicare Advantage plans? You can also join or switch to another Medicare Advantage plan during the Medicare Open Enrollment period, or Open Enrollment. Open Enrollment runs from October 15th through December 7th each year, and anyone with Medicare can join, switch, or drop an MA plan during this time. Your coverage will begin on January 1st as long as the plan gets your request by December 7th. You can only join one MA plan at a time, and enrollment in the plan is generally for a calendar year. Plans must be allowing new members to join. Plans may be prohibited from accepting new members if there's a Center for Medicaid and Medicare Services approved capacity limit, or if CMS issued enrollment sanction